this video we'll be talking about hypertensive crisis. Now, what is the normal blood pressure? Our systolic normal blood pressure ranges from 110 to 140 millimeter of mercury, and our diastolic normal blood pressure ranges from 60 to 90 millimeter of mercury. Now, this is the basic. Now, what is hypertension? If the BP increases than this normal range, then we call it hypertension. Now, what is hypertensive crisis? When the BP is excessively high, right? What is the value, right? When we call this is a hypertensive crisis. Now, the value is when the systolic blood pressure is more than 180 millimeter of mercury and the diastolic blood pressure is more than 120 millimeter of mercury. This situation we'll call it hypertensive crisis, right? This is a very serious situation. This is a very critical situation, and we have to treat it as soon as possible. Now, basically there are two types of hypertensive crisis, right? Based on end organ damage. What is end organ damage? What our blood do? The blood used to supply nutrients and oxygen to the cells or organs, and if hypertension occurs, then this particular perfusion will not occur in a very good manner. So, in hypertensive crisis, the perfusion is not going on well. So there may be some damaging situations of the organs. So what happens in hypertensive crisis? There may be some damage occurring to that particular organ. There may not be any damage occurring to a particular organs. So based on it, there are two types, right? One is hypertensive urgency. Another is hypertensive emergency, right? Now, what is hypertensive urgency? When there is no end organ damage. When end organ damage is not occurring, so we call it hypertensive urgency. But the BP or blood pressure is more than 180 by 120 in both the cases, right? In both the cases, the BP is more than 180 by 120, right? But the difference is in urgency there is no end organ damage, but in hypertensive emergencies end organ damage is occurring. This is the difference. Okay, now first of all we need to know what are the end organ damages that can happen. So what are the end organ damage? I'm writing it in a short form, EOD. So right, first of all, it may cause myocardial infarction, right? Or it may affect the heart. Okay, how can we find out? We can do ECGs. We can see the cardiac markers, right? Second one is acute renal failure can happen, that is kidney. In this case we will get deranged RFTs, right? Next, there may be stroke happening. It may be ischemic or hemorrhagic. Okay, next is there can be hypertensive encephalopathy, right? There can be hypertensive encephalopathy. Now, what are the symptoms we can see in hypertensive encephalopathy? The patient will have headaches, confusion. There may be altered mental status. There may be altered mental status. So these are the symptoms we can see if hypertensive encephalopathy is happening or not. Next one, we can see pulmonary edema in chest x-rays. Okay. There may be happening of aortic dissection. So these are some of the end organ damage that can happen. So this is the main point. So always look at this particular organs if any damage is occurring or not. Okay, now let's come to treatment. First, hypertensive urgencies. Now in hypertensive urgencies, we have to reduce the BP in days and not in hours. That is, we can't reduce the BP very rapidly. We need to reduce the BP very slowly, right? So first point is, we need to reduce the BP in days and not in hours. First point. Why so? If normally what I'm just saying the overview of the reason of it. So firstly, if the pressure is very much high, what happens is the cells of the end organs are quite getting used to this high blood pressure, right? Now if we reduce the BP drastically, then there can be a situation of ischemia, or the cells will feel like they are not getting enough blood supply, right? Because they are used to it, used to the excessive blood pressure. Okay, now this the most severe situation that can happen is stroke in it, that is ischemic stroke can happen. Okay, and normally no oral medications are or hypertensives are normally given, but atenolol or long acting calcium channel blocker can be given, right? This is a normal management of hypertensive urgency, right? Now let's talk about the treatment or management of hypertensive emergency. Okay, in hypertensive emergency, the very emergency situation, right? And we need to reduce the BP in hours, first of all, right? As compared to reducing the BP in emergency, I mean hypertensive urgencies. So what we will do is reduce the BP as soon as possible, but still there is a protocol of it, right? What is the protocol? We need to reduce the mean arterial pressure not more than 25%, or we can say 10 to 20% as well, in first 1 to 2 hours. Okay, and after that we need to reduce the BP by 5 to 15% in the next 23 hours. This is the protocol. First of all, we need to reduce the mean arterial pressure by not greater than 25% or 10 to 20% in first or second hour, and next 23 hours we need to reduce the BP by 5 to 15%, this range. Okay, now generally we can if we talk about the drugs, in this case labetalol can be used, or nitroglycerin can also be used, or sodium nitroprusside can also be a preferred drug. But this whatever drugs we are using it on the basis of contraindication. Before using that drug, we need to know about the contraindications of that drugs, right? In certain situations we don't give labetalol. In certain situations NTG or nitroglycerin is a drug of choice, right? In certain situations we don't give sodium nitroprusside. So these kind of situations can happen. So this is not a sure shot or strict protocol to give these three drugs. There may be situations, right, of using drugs. So a better knowledge of contraindications of drugs and where to use, where not to use is very important in this case. Okay, and in this in the next video we will talking very accurately in which situation what drugs is preferable. So thank you guys, subscribe my channel. Bye bye.